You're watching 41 Action News.
Healthcare workers across our area have had their first dose of the COVID-19 vaccine, and more vaccinations expected today.
So this morning, once again, we're joined live by Dr. Hawkinson from the University of Kansas Health System. Doctor, we're so glad to have you again this morning with so much going on. Explain to us and to our viewers how you go about choosing which healthcare workers get the vaccine first, because there's still not enough to go around. We know that Dr. Stites, at least from KU Health, has said he intends to have it on the morning calls whenever he's available to do that. How do you decide what the breakdown is there?
Yeah, you know, it's very difficult. We know that the demand is high, the supply is little. We hope the supply increases, but what we're doing at the health system is really looking at your exposure risk, so the time and intensity of exposure. So there are certain groups of employees who have much more exposure than others. For instance, respiratory therapists who are helping those COVID patients with their breathing treatments and exposed to those small particles that may be generated during those breathing treatments. It's the physicians and the nurses in the ER or on the regular COVID unit or in the ICU. Those are the highest groups. And after that, we've had to stratify out further people who are at less risk. For instance, I'm in a second group. Even though I do see COVID patients, I don't have as much or intensive exposure as some of those other groups I've mentioned. So it's really stratified by exposure risk.
Doctor, Pfizer's vaccine is designed for 5 doses per vial, and we reported today, the FDA announced despite what the label reads, pharmacists can squeeze out extra doses if there's some left. Some cases say additional 2 doses. That made us really curious. How is that possible? I guess I was assuming that 1 vial, 1 dose. How could there be more in there?
Yeah, so it is a multi-dose vial. So you can get 5 was what they had reported. I know on one of our calls with the state or with a local group when we were prepping for our vaccine, they had talked like they were getting 6. Pfizer has said this is how much volume, this is how much fluid is in there. You do have to mix it with other fluid to get those 5 doses. But apparently some people were saying there are 6. I think that's okay as long as we make sure that we're looking at it. And if you get those 6 or 7 doses, really understand and make sure that you can be getting that 30 micrograms per dose in those 5-dose vials, especially if you're now getting 6 or 7. You really need that amount of the vaccine product, that 30 micrograms, really to have your best chance at immunity, both for this first dose and the second dose as well. I think it's good if it can expand our amount of vaccine, but then on the back end, for when people come back in 21 days, we have to make sure that we can also give all those extra people who seemingly got this first dose, make sure we can get all those extra people that second dose as well.
Can you guarantee there will be an extra dose in that next vial they find? That's interesting.
Correct.
I have one more question. Yeah. This came from a viewer last week, but I think the question still remains. She has a friend who had heard there were side effects to the vaccine, so they don't think they're going to get it. We've talked a lot about public trust in the vaccine. Can you give us the latest on any side effects that we've seen and the safety that you're seeing so far?
Yeah, absolutely. You know, hesitancy is okay. Just make sure you continue to read and do your due diligence of getting all the correct information. Right now, we have given the vaccine to a number of employees. I'm not aware of any specific problems or issues. We do have a hotline they can call. We only really started giving vaccine Tuesday, so we will probably start getting some information about that. I don't have anything specifically, but we know a lot of people, 85 to 90% of people, will get some pain in the shoulder where the vaccine was injected. That pain will last 24, maybe 36 hours. You probably won't even need to take Tylenol. Other people will get fatigue. They'll get a little bit of temperature elevation or fever. They may get some lymphadenopathy, which is a swelling of your lymph nodes under your arm where that vaccine was given. But those symptoms and those signs really all seem to go away within 24 hours, so there's nothing long lasting. But again, there are adverse events reporting systems. There are new apps and reporting systems that everybody is anxious to download and hopefully report on and then collect that data. But right now, again, both of these vaccines, Moderna and Pfizer, do look very safe as well as efficacious. So I think that's okay to be hesitant, but make sure you continue to read and get the full information.
Doctor, as always, thank you very much. You can see Dr. Hawkinson in the daily update from KU Health on our 41 Action News Facebook page starting at 8 o'clock every weekday morning. Doctor, thank you.